ചാലക്കുടിയിൽ നിന്നാണ് ഞങ്ങൾ വരുന്നത്. ഉമ്മാക്ക് അവിടെ ഒരാഴ്ചയായിട്ട് ഭയങ്കര ഛർദിയായിരുന്നു. വയറ്റിൽ നിന്നൊന്നും പോകാതെ ഭയങ്കര ബുദ്ധിമുട്ടും വയറുവേദനയൊക്കെ ആയിരുന്നു. അങ്ങനെയാണ് ഞങ്ങൾ അങ്കമാലി അപ്പോളോ ഹോസ്പിറ്റലിലേക്ക് വരുന്നത്. അവിടെ വന്ന് അഞ്ജു ഡോക്ടറും കാർത്തിക് ഡോക്ടറെയും കണ്ടു. അവർ അപ്പോൾ തന്നെ ഇത് ബുദ്ധിമുട്ടുള്ള ഇതാണ്, അതിൻ്റെ പേരിൽ എത്രയും പേര് നമുക്ക് ഓപ്പറേഷൻ നടത്തണമെന്ന് പറഞ്ഞു. അങ്ങനെ ഞായറാഴ്ച ഓപ്പറേഷനായിരുന്നു. നമ്മുടെ അള്ളാഹുവിൻ്റെ അനുഗ്രഹം കൊണ്ടും ഡോക്ടർമാരുടെ എല്ലാവിധ സഹകരണം കൊണ്ടും ഈ ദിവസത്തിനുള്ളിൽ എല്ലാം കൊണ്ടും വളരെയധികം ഉന്മേഷവതിയായി. അതുപോലെ തന്നെ അവിടെയുള്ള എല്ലാ നേഴ്സുമാരും ഇവിടെയുള്ള എല്ലാ നേഴ്സുമാരും ഞങ്ങളോട് നല്ലവണ്ണം സഹകരിക്കുകയും നല്ല ഇമ്പ്രൂവ്മെൻറ്റും ഒക്കെ ആക്കി അവർ തരികയും ചെയ്തു. അതിൽ വളരെയധികം സന്തോഷിക്കുന്നു. അത്ര ഉഷാറായിട്ട് ഉമ്മ വന്നതിൽ ഞങ്ങൾ വളരെയധികം സന്തോഷിക്കുന്നു.
Namaste. So this patient, Mrs. Aisha, 90-year-old lady, she came to our emergency department with 7 days history of continuous vomiting, abdominal pain. So she was evaluated in multiple hospitals. They could not find what was the cause of this pain and vomiting, and she was being managed by medicines. So when she came to us, I remember it was a late evening, and we examined her. We found that there was some problem in the abdomen. The abdomen was very distended. So we thought of evaluating her further and taking a CT of the abdomen. And after taking a CT, we found that her small intestine was having some obstruction. It was basically a very, very rare kind of hernia. It's known as Obturator hernia, where one part of intestine was going inside the hernia and causing some kind of blockage there. That's why she was having such symptoms. And for the last 7 days, she could not eat anything. And she was really sick. She was really tired and she was dehydrated. So we thought, okay, we will immediately, give her some fluids, started antibiotics, put a tube in her nose so that we can decompress her intestine. And as soon as possible, her sodium was very less, her potassium was very less because of so much vomiting she had. We corrected that, and as soon as it was feasible, we took her for a surgery. So what we planned was a laparoscopic surgery for her, because routinely for all hernia cases, we do a laparoscopic surgery where the results are much better. The patient's post-operative course is much comfortable. The pain is much less. But this being a 90-year-old lady, it was quite difficult decision to do for an open surgery or a laparoscopic surgery. But we discussed the case with our other consultants, including anesthesia team, and they were happy to give anesthesia for a laparoscopic surgery, general anesthesia. And on a Sunday, we took this patient as an emergency. And intra-op, we found there was a part of small intestine which had gone inside the hernia and causing obstruction there, some blockage there. With that part, we had to take it out. And this segment was looking very unhealthy. So we had to cut this segment and join the two intestine. And then after that, we had to go and find the hernia, and we had to repair the hernia by using a mesh as well. Otherwise, if you don't repair the hernia, this again the condition will recur. So there was a problem because this is a very elderly lady, 90 years, other comorbidities, having a emergency surgery with very low sodium, potassium, under general anesthesia, and also that we had to cut a part of intestine, which makes it a very, very complex and major surgery. However, seeing the patient's condition, she was a pretty active woman. At her home, she was doing all her activities by herself. We thought, okay, we'll give her a chance and we'll do the needful. And post-operatively, she did quite well. However, the recovery was slightly slow, but then she recovered quite nicely. Physiotherapy department was on her. She was mobilized the next day of surgery. And slowly, she recovered well. We gave her some IV nutrition. And once she recovered, she started on oral diet. And slowly she walked and she passed stools, and we were very happy. And when we got 8 days after surgery, she was perfectly fine with no wound infection, no pain. And she walked happily to her home. So such kind of obturator hernias are pretty rare hernias, which happens mainly in elderly patients, in females who are thin built, and we don't see them very often. But when they happen, it's not very obvious where they're happening, so it's that diagnosis sometimes missed compared to normal inguinal hernias or umbilical hernias. So finding them is a very, very big challenge, and operating on such patients who are already elderly, already having so much comorbidities is quite a challenge for all the surgeons. However, this case was a special case because she is 90 years old, very cooperative lady. She was always having a smile on her face, and we were happy that we could give her a good outcome. So the message is that all hernias, if you have, hernia is a surgical condition basically. It's not a medical condition. No amount of medicine or drugs can treat any hernia. It's an anatomical hole in the abdomen wall or anywhere in the abdomen through which the abdominal contents can go outside, like fat and intestine, and can cause complications like obstruction or pain, even emergencies. So if you have a hernia, it's just always advisable to meet a surgeon and get it repaired in the adequate time. Otherwise, a simple surgery can become a very complicated one. And if you do a surgery in the adequate time, the outcomes are much better compared to a complicated surgery. So please take advice of a consultant surgeon if you have any hernia, and feel free to contact us in Apollo Edlux anytime. Thank you.